Hi, I am Dr. Prabhakar. I am a lead consultant, general surgery and minimal access surgery at Aster Hospital, Whitefield. Today, we are going to talk about common disease among us is gallbladder stones, also commonly called cholelithiasis. What are these gallbladder stones? Basically, the gallbladder stones are the stones which are formed in the gallbladder. Gallbladder is situated just below the liver in our upper body. There are different kinds of stones. It can be a cholesterol stones or it can be a bile salts, bile pigment stones. How these stones are formed? So they formed because of accumulation of bile for a longer duration in gallbladder, or if the gallbladder is not functioning normally, it can form. And also, if there is a variation in concentration of cholesterol, bile salts and bile pigments in our bile, it can lead to stones formation. Are these different from kidney stones? Definitely yes. The kidney stones are different from gallbladder stones, location wise as well as organ wise, and how they present. Basically, any stones can present with pain in the abdomen. So what are these symptoms of gallbladder stones? So basically, all gallbladder stones will not cause symptoms. There can be a asymptomatic stones, it can present for many years without being us known about the stones. However, many people will suffer from minor symptoms like it can be a bloating sensation in the abdomen, or fullness in the abdomen, or burning sensation, or colic pain in the abdomen. The major symptoms are sometimes it can be a severe pain in the upper abdomen with vomiting, and they can present with jaundice and fever secondary to infection. So there are some misconceptions of treatment and prevention regarding gallbladder stones. See, basically many can be asymptomatic stones and which may not present as symptoms in their lifetime. So many people think that drinking too much of water can flush out the stones. However, it may not be true. And some people practice a GB flush, that is gallbladder flush, where they consume olive oil along with some herbs so that the gallbladder stones are flushed out. However, scientifically, it's not proven. Some people think that drinking too much of apple juice might reduce the size of the gallbladder stones. However, scientifically, there is no evidence to see that size of the stones are decreasing. So once the gallbladder stones are detected, so everybody will be afraid. They think that removing of the stones or removing of gallbladder is the only treatment. Yeah, it is not always true. Gallbladder removal is one of the way of treating gallbladder stones. However, it may not be necessary all the time, because asymptomatic patients, we leave them and observe them as long as they become symptomatic. However, better to reach out once they have above said symptoms, like in case of severe pain and vomiting, better to reach out to the surgeon immediately. So how to prevent the stones formation? So basically, better to have a healthy lifestyle, eat balanced diet, drink plenty of water, reduce the fat intake, so that at least to some extent stones are prevented in formation. So what is the treatment of the gallbladder stones? As I said earlier, asymptomatic stones can be left alone as and when the symptoms starts. The surgeon will investigate further with the ultrasound and few blood tests. And when it is absolutely required to be removed, we do surgery in terms of minimal access surgery, that is laparoscopy, to remove the gallbladder. To stress the point, so it is the removal of gallbladder is the permanent treatment, and only removal of stones is not the way to treat gallbladder stones. We here at Aster Whitefield Hospital have an excellent minimal invasive department surgery, laparoscopic department surgery. In case of any pain in the abdomen, if you are diagnosed with gallbladder stones, better to meet one of our surgeon to know more about treatment options at Aster Whitefield Hospital. Thank you.